I'm Dr. Nathaniel Chin, and you're listening to Dementia Matters, a podcast about Alzheimer's disease. Dementia Matters is a production of the Wisconsin Alzheimer's Disease Research Center. Our goal is to educate listeners on the latest news in Alzheimer's disease research and caregiver strategies. Thanks for joining us. Welcome back to Dementia Matters. According to the Dietary Guidelines for Americans, adults of legal drinking age should limit their alcohol intake to 2 drinks or less in a day for men and 1 drink or less in a day for women. Now, if you're one of my clinic patients and over the age of 65, you'll hear me mention the National Institute on Alcohol Abuse and Alcoholism guidelines, which recommend people, male or female, drink no more than 7 drinks per week and not more than 2 in one single day. Most people might interpret these guidelines as safe levels of alcohol consumption, but more and more research is telling us even these moderate levels of alcohol use have negative consequences for health and pose an increased risk for some diseases. My guest today is here to talk about his recent research that found even 1 drink a day can shrink your brain. Remi Daviet is an assistant professor of marketing at the Wisconsin School of Business who uses machine learning and artificial intelligence to understand large data sets. Thank you for joining me today on Dementia Matters.
It's a real pleasure to be chatting with you today.
Let me start by saying your results are not welcomed by many people, but since they are so important for us to understand, let's really jump into this. Where did the idea for this study come from, and how did you and your team work on this project?
So it started with a very different objective. I do some neuroeconomics. That was my specialization into during my PhD, along with computational statistics. And so I was looking to find patterns in the brain that will be associated with drinking, but find a causal link in the other direction. Like what different patterns are linked to more drinking using instrumental variables based on genetics. So if people might be more favorable to drinking, see if we could identify part of the brain that will lead to drinking. And the issue is that it seems that alcohol might have such a strong effect on the brain and so early in consumption that it drowns all the signal I had from my statistical method to try to identify the reverse pattern. And so my research, my original project didn't work out the way I wanted. But when I talked to people who were more specialists of brain and addiction, the other people who joined the team, they thought that was actually really interesting. And so that's how we pursued that project.
That's interesting. So this is an incidental finding that was really quite remarkable and kind of put you on a new path.
Exactly.
Well, the scientific research on alcohol consumption can be really confusing, particularly for the general public. On one hand, there are studies that show that some alcohol can be good for the heart or help lower the risk of diabetes, particularly in women. But then on the other hand, there are studies that show even minimal alcohol use will increase the risk of cancer. And now your study about the very serious associations between alcohol and brain changes. So before we get to the actual results of your publication, when you're with other people, how do you suggest they balance all of these conflicting messages?
Well, I can first present it as a good news. The good news is that up to 1 drink a day, we don't find any effect even in a very, very large sample. So you can drink 1 bottle of wine per week and we don't detect any difference in the brain. So that's a good news, I think. Now, for above this consumption, even though we don't really have a causal effect identified, we have strong suspicion, let's put it like that, you will have to drink 2 small glasses every day of the week to reach the level where we find that there is some negative association. And even though at this level, the equivalent in age, we put it at 2 years, but 2 years in brain age is not that much. I don't think my brain is very different from what it was 2 years ago. I don't know how you feel about yourself, but on that scale of time is not. I wouldn't be too worried. However, when you go above this, so you start drinking 3 units or 4 units, 4 small glasses every day, because the effect is exponential, that's where we start seeing really strong magnitude in terms of the association. And that's when I would be more worried. The good news about that, again, is that if you just cut the last glass, you might cut the effect in half if there is an effect. So it's easy to, you don't have to stop drinking. Just removing the last glass is where you have actually the strongest potential benefits.
And that's a great teaser because I am going to ask you about more of these specifics of how much and at what point. But your paper also mentions something that I think is really important for our listeners to hear. And you talk about gaps in research. And one of them being that many studies look at alcohol use disorder, so actually having a medical problem, and not really directly at mild users or recreational use. And the other gap that you identify is that there's a lot of other potential factors that could be influential when you study the impact of alcohol on health. And you list things like age, sex, body mass index, and even your genetics. So, were you able to account for any of these kind of gaps or factors in your particular study?
Yeah, we tried to control for a lot of things. First, about why we went into moderate consumption and not just heavy drinking or use disorder. I think it's very difficult to study because brain scans are very expensive, and until we had this database provided by the UK Biobank, it would be almost impossible to have the funds to do a study with enough sample size that is large enough to detect small changes like this. Right, brain imaging is blurry. You have to align them. You have to put it through a whole process to try to find exactly what's the size of each part of the brain. So that's kind of new that we are allowed to do this kind of research, and that's why we are starting to fill the gap. Now, the in terms of controls, yes, we control for genetic ancestry and for other things like presence of ADH1B, genetic variation that will change the way alcohol is metabolized in the body. Age, sex, we did several studies where we looked for linear effect, non-linear effect, interactions, all these kind of things to try to be as thorough as possible. The other issue with this type of research is that you cannot experiment. You cannot take a group and split them randomly and say, hey, you're going to drink 4 glasses a day just to see how it affects your brain. So that's why it's very difficult to identify a causal effect, and we can only have some kind of association where these other variables might give the wrong interpretation if there is other causal patterns involved.
One other question I have for you before we get to the results is there an effect of alcohol consumption, an interaction with just getting older?
It is hard to say because the magnitude of the interaction is very small, and given that we have very large sample and not able to confirm for sure that there is an interaction, I wouldn't be concerned about this.
I think that's good for people to know that we're all aging, especially if you're a retired person, that doesn't seem to have a particularly strong interaction when it comes to one's health. But now with all of that context provided, I'd really like to start with the end conclusion from your paper and then backtrack to see how you got there. So then what did your results show in this publication?
So the result shows that if you take two persons, same age, same sex, same head size, same genetic ancestry, the one drinking a large glass of beer or wine every day, or two small glasses, and I do mean every day, not once in a while, this person has on average a brain with a bit less of gray matter and white matter. If we compare this reduction with normal reduction of brains that happens with aging, that's equivalent to 2 years of aging at 50 years. So that's not that large. Your brain is not that different from what it was 2 years ago. However, if you go beyond this limit, for each small glass you add, we can see that the difference is larger and larger. And so for 4 units, now it's not just 2 years, it's 10 years, the difference in size of the brain in terms of equivalent aging.
Wow. Okay. So I have a couple responses to that. So, Remy, as a geriatrician, 2 years of cognitive brain health, it can be significant to people. You're a young person, and so I can appreciate you don't feel any different than you did 2 years ago. But someone in their 70s and 80s might tell you they might feel it. But 2 years, so that's what one drink a day, one large drink a day leads to 2 years of sort of accelerated aging compared to people who don't drink. But I appreciate your second point, which is that more than that, exponentially, your brain is shrinking at 10 years, perhaps, depending on how much more. So it's a pretty significant change.
Yes, it is significant. And concerning your point about 2 years being not that large or being large depending on where you are, that's true. The effect of aging by itself appears to be linear. So every year past 45, you lose approximately the same volume of gray and white matter. Maybe there is a threshold at which, when you reach that threshold, you become able to notice it a lot more. And that's where maybe you might find that the observable effect of drinking more alcohol and interacting with age, they might be more noticeable, even though in terms of brain shrinkage, they might be just the same as they were before when you were younger. Once you have this threshold of a lower amount of gray matter, you might see that you start, forgetting things that happened recently, where you put your keys, what you've told, what you've ate yesterday, these kind of things.
Yeah. So the tipping point kind of theory that, as you've said, at 45 and on, it's a linear change, but there could be a tipping point where you start to actually notice that change more. But how did you come to these findings? I mean, you used some brain imaging, so can you tell us what you looked at and how you came to these conclusions?
Yes. So the UK Biobank is a large project that was started by public institutions in the UK, where they decided to take a lot of people. So we have 500,000 people, and do an extensive medical checkup and get their genome sequenced. And then among those, they started doing brain scans. And so we had this large sample of 30,000 people with brain imaging. And once we have this large sample, and we also have alcohol consumption and dietary consumption, all these kind of things, we thought it would be interesting to start looking at these brain scans. So we kind of align them, or we make the brain comparable, and then we try to see differences among people, because brain differs. So you have first to make them standardize them so that they can be compared. Then the part of the brain is kind of cut into different parts, so that we know, which part is the hippocampi and what part is prefrontal cortex. So we have the volume of gray matter in that part of the brain, the volume of white matter between part of the brain, because they are acting as connections for transmitting signal, what part is just liquid. And once we have all these data, it's a matter of trying to find statistical associations by using statistical techniques.
And it was through that you were able to come to this conclusion of a drink a day leading to 2 years of accelerated kind of aging and then even more with more drinking.
Yes, exactly. So because we have so many people, we can really, compare people by groups of drinkers. So people who don't drink, people who drink up to one drink a day, people who drink up to two drinks a day. And we had a lot of people in each of these groups, a bit less in the very heavy users, but still enough to detect effects, because or detect associations, because they become so strong basically at some point. So it's hard to miss.
And so were there certain parts of the brain that were more impacted than others based on what you were looking at within the brain scans?
Overall, the effects might vary slightly across part of the brain, but I would say that the big picture is that it's everywhere in the same direction by about the same amount.
Well, I think that's an important finding too. So it's really affecting our entire brain and not just our language or our memory or our attention. So I think a question that our listeners have probably already been asking as we've been talking is how are you defining alcohol consumption? And can you explain what a unit of alcohol is in terms of beer, wine, and hard alcohol spirits?
So it's a bit variable across beers, because you can have a very light beer or you can have a very strong beer. So for the average beer, a pint or a can that's half a liter, the large can, will be 2 units. For wine in America, the standard glass of wine is almost twice as large as what you would have in Europe. So 175 milliliter, about 5 ounces, is 2 units. And then shot of spirit, the standard shot is 25 milliliters. That's 1 unit of alcohol, 1 unit of alcohol for this study, as we count them in Europe. So you can see, be careful if you look at guides in the US or in North America in general. Sometimes what they call 1 unit for them is what we call 2 units based in Europe.
So your study found that One or 2 units per day led to the 2 years of accelerated aging.
2 units. So that will be for the US 1 pint of standard beer. That's around 6 or 7%.
Or even a standard glass of wine.
Yes, also a standard glass of wine would match this 2 units description.
Yeah. And I mean, let's not forget that people do what's called a home pour and they drink more than what is considered a standard glass. So I think that's just really important for people to recognize that these are small quantities of alcohol, and even these small quantities have led to changes on the brain scans that you were reviewing. So then I guess for me, as someone in a clinic, it'd be interesting to know how these individuals that you studied perform on actual cognitive testing and if the changes you saw in the imaging actually had relationships to these performances. But I guess I'm wondering from your perspective, what are the next steps with this type of work?
So what is difficult is that if we're really looking at just brain effects or association with brain anatomy, we need large samples to look at this, and we don't always have these large sample and also psychometric tests of cognitive performance or other kind of tests. We might start to look at that because I know there is some data available. Otherwise, the alternative will be to study on a purely psychometric or behavioral dimension, and then try to associate alcohol intake with these outcomes. I would be curious actually to hear if you or your audience have ideas about how to run this and control for all the potential confounds and reverse causality and all the issue you might run it when you run this kind of studies.
It's certainly not an easy study to do, but I think you're really onto something, even if we may not necessarily like the results that you're coming up with. At least we know they're valid. My last two questions for you are one, did the findings of this study cause you to stop drinking? And two, regardless of that answer, what do you do to promote brain health after studying so many brains on imaging scans?
So it didn't really change my drinking habits because I was already below 2 units per day. I might have 2 units in one day, but that happens every 2 weeks maybe. So I'm not too concerned about that. Now, what I will advise people, yeah, I'm not the best specialist. I do as everybody else. I read the literature about this to make my decision. So if you keep a healthy lifestyle, I feel that's the answer to everything, not just brain health, but health in general. Keep using your brain. Don't let it go, basically. And the more you use it, the healthier it will stay. When I look at the association between age and brain shrinking, for a group of individuals in the same age within a sex, there is large variations. So you have people who are 80-year-old with brain that are they look as young as a 50-year-old, and you have people who are 50-year-old who have a kind of age brain who are already like an 80-year-old brain. So I am hopeful that it's possible to keep a young brain even as we are aging.
I think that's a nice way of ending. There is a lot of variability, and age is merely a number at times. So, with that, thank you, Remy, for being on this podcast and sharing with us the findings of this very interesting study.
That was a pleasure. Thank you.
Thank you for listening to Dementia Matters. Follow us on Apple Podcasts, Spotify, Google Podcasts, or wherever you get your podcasts to be notified about upcoming episodes. You can also listen to our show by asking your smart speaker to play the Dementia Matters podcast. And please rate us on your favorite podcast app. It helps other people find our show and lets us know how we're doing. Dementia Matters is brought to you by the Wisconsin Alzheimer's Disease Research Center. The Wisconsin Alzheimer's Disease Research Center combines academic, clinical, and research expertise from the University of Wisconsin School of Medicine and Public Health and the Geriatric Research, Education, and Clinical Center of the William S. Middleton Memorial Veterans Hospital in Madison, Wisconsin. It receives funding from private, university, state, and national sources, including a grant from the National Institutes of Health for Alzheimer's Disease Centers. This episode of Dementia Matters was produced by Rebecca Wazaleski and edited by Kaylin Rowerdink. Our musical jingle is Cases to Rest by Blue Dot Sessions. To learn more about the Wisconsin Alzheimer's Disease Research Center and Dementia Matters, check out our website at adrc.wisc.edu. That's adrc.wisc.edu. Follow us on Facebook at Wisconsin Alzheimer's Disease Research Center and find us on Twitter at Wisconsin ADRC. If you have any questions or comments, email us at dementiamatters@medicine.wisc.edu. Thanks for listening.